When we're thinking about healthcare, what do we need at a reductionist level to be providing healthcare? And there are only three things that we need. We need a patient, we need a healthcare worker, and we need some information. And I guess years ago you might ask doctors and nurses, what did you need for healthcare? And you get different answers. Oxygen, treatments, pills. But those are the three things we need, and information is now high on the agenda. This is the area that I work in. I'm based at Lancaster, but work in Kendal and Barrow. And this is a geographically challenged area to provide healthcare in. I would say that the traditional hospital paper record is a passé concept. We can't deliver 21st century care on paper. Some of the other challenges that we face include ageing populations, increasing fragility, increasing rates of dementia, larger cancer survivorships now, which is great, chronic disease, complex pathways. Patients are not just being treated by one doctor or one team or one hospital. It's multi-organisational care. It's complex. And there are other challenges related to poverty, access to healthcare and so on. This is the world that we've come from. This is not my secretary's office. This is the world that we need to go to, where whatever paper is in the system is ordered. We have a healthcare environment where we have one corporate EPR system in the hospital sector for the three hospitals, and we have one GP EPR system. And we've been able to connect those two systems over the last few years. And in 2011, we started to send out electronic letters securely from the patient record in the hospital to the GP system. And not only does it just go into the GP practice, it actually goes into the patient file. This is the world that we came from, which was unintelligible rubbish on the left, triplicate handwritten notes with not great information. And on the right, we're producing standard letters with structured clinical terms in the boxes, which can be used and reused information for further healthcare later on. So our GPs loved the ability to receive these letters in the last 3 years. My area straddles Cumbria and Lancashire, and I work closely with doctor colleagues in both areas, and there's been a lot of connecting work in Cumbria in the same way that there has been in Lancashire, and it relates to providing the technical infrastructure, the hardwiring, the networking. There's a project around virtualising desktops, having interoperable electronic patient records, and so forth. So basically the requirement is for the right information to be at the point of care, so that the clinician can treat the patient or make the right decisions at point of care. And that's a really required thing for us to be able to give patients a better experience. So what we're looking at here is a screenshot of a GP system, EMIS Web, and it shows some of the features and the information that's logged in that system, but it also illustrates that there's a consent model in there, so patients can give their consent to share. This is a different view of the GP system, but it shows that this system can connect with community resources such as wards or in Kendal Hospital and community nursing teams and so on. So this record is shared. We're looking now at the EPR system that we use in Morecambe Bay hospitals called Lorenzo, and there are all sorts of function tabs down the right-hand side which take you into areas for health issues, results, documents, and so forth. However, in the central pane, what we're seeing there is a GP summary view which is being presented from the GP record into the the view within the hospital system. So we've got links and we can see a summary of that patient's GP record. And you can appreciate the major advantage that this holds at the front end acute care. So for instance, if we have elderly, confused patients, unconscious patients arriving in hospital, we can immediately get a quick view as to what their illnesses are and what their allergies are. Here's a different view showing a different set of information, and our palliative care teams, which span community and hospital, have been working pretty hard on the information sets that are required to share across hospital and community to provide that linked up personal care for patients in end-of-life care. So again, this is information and data sets that can safely support patients across the transition bridge between hospital care and community care. This is an on-call system at Astra, which is used in Cumbria, and this shows that an on-call GP can again access the GP record for the patient that they are called out to see, so that we have connected records, we have appropriate timely decisions made, patients get a better deal. This is something that this shows something that we've been working on in the last 12 months or so, which is a development that allows conversations to take place between healthcare workers in different spaces. So this at the bottom is showing a number of documents relating to something that has been locally developed called advice and guidance, and that this allows a conversation between a GP and a hospital consultant, and it may well be a clinical scenario-based discussion, which is not necessarily patient-linked, and will allow education of GP colleagues with support from consultants. Equally, it can be a patient-specific conversation that will allow specialist support of doctors in primary care, so that patients get more timely care. They have supported referrals, so it may well be that the GP can make a choice that after having the support of further advice from the consultant, they don't necessarily need to trouble the patient to come into hospital. On the other hand, they may have that extra information to know that it would be really helpful that when the patient comes to hospital, they are better prepped and have another test result available. The real value of this particular system is that it allows all of that information and that conversation to be captured in the patient record. It's not split from the record. It's not in an email system, which is not then part of the record. So this is how it views. So there's a bubble conversation which is captured in clinical notes. And it's captured both in the Lorenzo hospital system, and it's also captured in the GP EMIS web system. And this is currently up for a national award at Health Services Journal at the moment. So the thing for me is this isn't about doing nice things with technology. This isn't about making doctors or nurses' lives a bit easier. This is about giving patients a much better deal now and in the future. It's my belief that if we've got better information at point of care, we will make better decisions, patients get a better outcome, and the world's a better place. I just want to show you a very short Department of Health video clip just to illustrate why we need to change.